Good afternoon, everyone. As you can see, I'm joined today by Dr. Nicola Steedman, the Deputy Chief Medical Officer, and she'll answer questions with me shortly. Firstly, though, an update on the current state of the pandemic, starting with a summary of today's statistics. 1,604 positive cases were reported yesterday, 9.2% of all tests carried out, and that takes the total number of confirmed cases now to 332,455. There are 529 people now receiving hospital treatment, which is 7 fewer than yesterday, and 47 people are in intensive care. That is 2 more than yesterday. Sadly, a further 13 deaths were reported in the past 24 hours, which means that the total number of deaths registered under the daily definition is now 7,813. And as always, my condolences are with everyone who has suffered bereavement. Now, although case numbers remain high, and I'll cover the implications of that shortly, they are very much right now on a downward path. To illustrate that point, in the 7 days up to 2nd of July, there were an average of 3,305 new cases being reported each day. But in the 7 days to the 16th of July, that had fallen to an average of 2,112 new cases a day. So that amounts to a decline in the past 2 weeks of more than 1/3, and that is very encouraging. Because of that, we were able to go ahead yesterday with the move to level 0. But as I said a moment ago, case numbers, though they are definitely falling, do remain higher than we should be comfortable with. COVID, as we know, is highly infectious. Indeed, Delta is significantly more transmissible than previous variants of the virus. And although vaccination is weakening the link between COVID cases and serious illness, the virus is still potentially dangerous. And of course, long COVID is affecting many, including those in younger age groups. All of this means that vigilance and care remain really important. Restrictions were eased yesterday as part of a gradual process, but restrictions were not abandoned yesterday. Important measures and mitigations do remain in place, and we continue to ask people across the country, and I do so again today, to treat the threat that COVID poses seriously at this stage. I'll emphasise that point in more detail towards the end of my remarks, but before then I'll touch briefly on some other issues. The first of those is vaccination. As of this morning, 3,984,433 people had received their first dose of vaccine. That's an increase of 2,483 since yesterday. As you can see, we're getting to the end of first doses. In addition to that, 16,340 people had a second dose yesterday, and that means the total number of second doses is now 2,995,086. All adults have now been offered first dose appointments. Indeed, that has happened earlier than we had initially anticipated. And as of now, around 90% of all adults in the population have actually taken up the opportunity and had the first JAG administered. Also, more than 2/3 of all adults have had the second dose as well, and that proportion will continue to rise on a daily basis as the programme of second doses continues. Remember that the clinical advice is that in order to maximise the protection and the longevity of the protection of the vaccine, we should leave 8 weeks between first and second doses. I think it's important to say that the level of uptake achieved so far is quite remarkable by the standard of any previous vaccination programme. And it actually exceeds what we dared hope for when this programme started back at the turn of the year. That said, we want to see uptake levels increase further. We want to get as close to 100% uptake as it is possible to do. To put it bluntly, each and every single person who gets jagged helps us take a step back to normality. And of course, the converse of that is true. For as long as there remains a proportion of eligible people who have not had the vaccine, that leaves us with a vulnerability against the virus. So we must keep at it. Although around 90% of all adults have taken up the offer of the first dose, so far amongst 30 to 39-year-olds, that is only 81%, and in the 18 to 29-year-old age group, it's 70%. So I want to stress again today, and we will keep stressing this, that if you are aged 18 or over, and if you haven't yet had the first dose, then you can still get it. In fact, we really, really want you to get the first dose of vaccine. You can access that by registering online through NHS Inform, but remember, you don't have to register. You're also able to simply turn up at one of the drop-in vaccination centres that are now operational across all mainland health board areas. COVID is, and this is something we should always be thankful for, is less of a threat to younger people than to older people, but that doesn't mean it poses no threat at all to young people. Some young people do need hospital care when they get the virus. Some young people will even end up in intensive care. And of course, as we know, young people can get long COVID, which we still don't fully understand the implications of. Vaccination will help protect you from those risks, but it will also help you protect other people. So please get vaccinated as soon as you possibly can. If you know somebody in a younger age group in your own family that hasn't had the vaccine yet, please encourage them to do so. There's lots of information on the NHS Inform website, not just about how to get the vaccine, but about the vaccine itself. It is a safe vaccine, so please get it, or encourage those you know who haven't done so already to get it. It is the single most important thing any of us can do right now to give protection to ourselves, but also protect others, and of course help all of us collectively get back to more normality. Now, obviously we want to extend the protection of the vaccine as far as we can. And to that end, the advice yesterday from the Joint Committee on Vaccination and Immunisation, the JCVI, on vaccination of 12 to 17-year-olds is important, and I want to spend just a couple of minutes talking about that. At this stage, given that it considers the risk of 12 to 17-year-olds falling seriously ill from COVID to be very low, the JCVI is not recommending that we vaccinate all young people in that 12 to 17-year-old age group. Now, the Scottish Government has always followed the advice of the JCVI, and for good reason. You'll have heard me talk about that before in different contexts, including recently that 8-week interval between first and second doses. But I am acutely aware that some other countries are vaccinating younger teenagers, and I certainly consider it to be extremely important that this is not ruled out here. So to that end, the Chief Medical Officer is writing to the JCVI asking that the benefit of vaccinating all 12 to 17-year-olds is kept under close and ongoing review, and that it takes account of all available data from countries already doing this. And I think that is really important. If there is a benefit to be got from vaccinating younger teenagers, then it's really important that we make sure younger people don't lose out on that. In the meantime, though, and most immediately, we intend to get on with implementing what the JCVI is recommending, and it is recommending that vaccines should be offered to specific groups of 12 to 17-year-olds. Vaccination is already available to 16 and 17-year-olds at higher risk of falling seriously ill, and they will continue to be eligible. But in addition, the JCVI is advising that 12 to 15-year-olds should be eligible for vaccination if they have Down syndrome, severe neurodisabilities, or underlying conditions that mean their immune systems are suppressed. In addition, it advises vaccination for 12 to 15-year-olds with severe learning disabilities, with profound and multiple learning disabilities, or who are on the learning disability register. And finally, vaccination is recommended for 12 to 17-year-olds who are household contacts of people with suppressed immune systems. And in that latter case, that is less about the protection of the young person and more about the protection of somebody they may live with. Now, we'll shortly provide details of our operational plans to vaccinate these groups of young people as quickly as possible. And of course, in light of what I said earlier about this advice being kept under review, we will make sure that we are prepared to go further as soon as that is recommended, if indeed that is recommended. Now, the final point on vaccination I want to stress is that if you are currently 17 years old, but if you are due to turn 18 on or before the 31st of October this year, you are now eligible for vaccination as part of this year's programme. You can self-register again through the portal on NHS Inform or go to a drop-in centre. So I want to emphasise this point today. If you, or indeed if you know somebody in this category, if you're due to turn 18 before the end of October, register for an appointment or go to a drop-in centre and get your vaccination as soon as possible. Now, finally today, I want to return briefly to the need for all of us to continue to treat this virus seriously and follow all of the rules and advice still in place. We did take a further, very welcome step back to normality yesterday with the next step in what is a careful and gradual easing of restrictions. And full details of what that means are on the government's website. These rules are more relaxed, considerably more relaxed than the ones we've all had to live with in the first part of this year. But as I mentioned at the start, case levels are still high and COVID is still dangerous. So I want to comment more today on the things, in addition, of course, to that vital imperative of vaccination, that it is important for us still to do so that we are individually and collectively reducing the risk. Because of vaccination, we are undoubtedly in a much better position than we were last year or even at the start of this year, but we can't abandon caution altogether, or at least we will be foolish if we do that. We all still have a role to play in helping to protect ourselves and each other. So firstly, although the limits have increased slightly as of yesterday, the limit on the number of friends and family who can meet together, 8 people from 4 households indoors, 15 from 15 households outdoors, is still really important because that limits the number of households the virus might spread to as the result of one social occasion. Face coverings also remain important and a really good way for all of us to help protect each other. And of course, they continue to be a legal requirement in certain settings here in Scotland. And indeed, that requirement to wear face coverings in some settings is likely to remain in force for some time to come. Also, please test yourself regularly, particularly if you're planning to visit somebody or go to an event, or perhaps if you're planning to spend a few days on holiday in a different part of the country. Free lateral flow tests can be obtained through NHS Inform. You can get them by post, but you can also collect them from testing centres and local pharmacies. And remember, if you test positive through one of these devices, or indeed if you have symptoms of the virus, then you should self-isolate and book a PCR test as quickly as possible. And lastly, because it remains really important, please keep following all of the basic hygiene measures. Meet other people outdoors as much as possible, and particularly while the weather is as good as it is right now, a really good opportunity to stay outdoors and minimise the risk of transmission that bit more. As I said a moment ago, stick to the limits on group sizes, and if you are meeting indoors, open windows, keep rooms well ventilated. And please remember, physical distancing, hand washing, face coverings, as I've just said, all of these measures are as important now as they have been throughout. And if all of us do these things, then I hope we will see cases continue to fall in the days and weeks to come. And if that happens, then that creates the conditions, we hope, for a further easing of the remaining restrictions over the next few weeks. So my thanks again to everybody for all of your cooperation, all of the sacrifices you continue to make. It doesn't get any easier, but it remains really important. So my thanks to everyone. I'll now move on to questions from the media, and Dr. Steedman, of course, will help me with these. And first today, Kay Nicholson from STV.
Good afternoon, thank you. First Minister, you mentioned long COVID in younger age groups, and I appreciate Dr. Steedman is now writing the letter regarding possibly expanding the vaccinations to all teenagers. But would you argue that, well, some will certainly argue that those maybe suffering from long COVID in the teenage group will fit into a grey area and they won't currently be vaccinated? What would you say to families who are concerned about the knock-on impact of that? Secondly, would you legally, there's lots of discussion about vaccine passports, of course, the Prime Minister yesterday touched on that around nightclubs. Would you legally be able to impose a vaccine passport if you choose to go down that route?
I'll deal with that second question, say a very brief word about the first question, and then I'll pass over to Dr. Steedman, particularly on the issues around long COVID and younger people in particular. We haven't taken a decision on whether or not to require vaccine passports in any particular setting. That will be something we're considering over the next period. I've said many times before, while there are arguments for requiring vaccination to allow entry to certain places, it raises sensitive ethical and equity considerations, not least because there are some people who can't get vaccinated because of health conditions, and we are not yet in a position of having a recommendation to vaccinate all younger teenagers. So we've got to weigh up these things very carefully, and while we're doing that we need to continue to be cautious. So just to remind people, and this is really, really tough for businesses in this sector, so I don't want to lose sight of that, but nightclubs are not open yet in Scotland for the reason that we think they do pose a risk to transmission. So we have to make sure that we are in a position overall where we think that risk can be managed and that we thought through all of the implications of the different mitigations. And we will set out the legal basis for anything that we do as and when we take those decisions. On long COVID, one of the things that continues to make me as a decision maker, a policy and a decision maker, most uncomfortable about the threat that we continue to face from COVID. I'm obviously uncomfortable with anybody getting seriously ill and requiring intensive care, and anybody who dies. No life should simply be written off as unimportant. But one of the things that makes me most uncomfortable, because it is one of the least certain parts of this, are the implications of long COVID, because we don't yet know exactly what long COVID entails. We don't know how long COVID is for people affected. We don't know whether it's a single syndrome or a collection of different potential syndromes. So as we are taking decisions that are trying to, a phrase I don't really like, but I'll use it for shorthand, live with COVID, it is difficult when there are aspects of this that we don't understand. So saying just now, well, we can just let young people get COVID, when we don't know that a year, 2 years from now, that will not have had serious implications, I don't think is an easy thing to do. And it's one of the reasons that I think it's really important that this issue of vaccinating younger people is kept under really close ongoing review and not kicked in any way into the long grass, that it is literally reviewed on an ongoing basis. The JCVI is the body that advises on these things. I've said before, I think it's really important that politicians like me don't overturn the decisions of the experts on these things, but equally, I want to be sure that we are reaching the right decisions on these things. Many other countries, or some other countries, are vaccinating younger people, and therefore, not only, but particularly because of long COVID, I think it's something that we must not rule out and must continue to look at the evidence on. Nicola.
Thank you. So just to add a couple of very small points to what the First Minister's already said. JCVI are very clear that they are looking at the individual risks and benefits of vaccination, and that goes for young people too. And they've considered all the risks and all the benefits of vaccination in young people, including long COVID. One of the issues about long COVID, as the First Minister has said, is that we don't know enough about it yet. But what we do know is that it seems to be much less common in younger people and children. And the severe effects of COVID, as you know, are also less common in younger people and children. And so the potential benefits of any vaccine to young people who are otherwise fit and healthy are obviously much, much less than those of us who are older. And there are, of course, potentially risks with vaccination, as there are with any treatment, some of which appear to be more common in younger people, such as pericarditis and myocarditis. So it's that really difficult balance of risk and benefits that the JCVI has had to do to come to the conclusion that they have for the time being. And I think that's the important thing. The JCVI has been very clear in their statement and in their discussions that this advice is for now and in the UK context, and that they are looking all the time at the evidence that is coming forward, both on the benefits of vaccination for young people and also on those risks. And if ever the evidence comes that that risk-benefit balance has changed, then I'm sure their advice will change also. So that's where we are in terms of long COVID, much less common in young people, but certainly something that JCVI have taken into account and will continue to do so.
Thanks. James Matthews from Sky.
Thanks very much, First Minister. You said that around 90% of adults have been vaccinated. Is that less than 90% of adults, still less than 90%, which was the stated target of 2 days ago? if it is, what are the implications for the 9th of August date for lifting restrictions? And second of all, can I just ask, Dominic Cummings has given an interview talking again about how Boris Johnson appeared to say to back away from restrictions because it was only killing people who are over 80 years old. In your mind, is that a resignation matter?
Thanks, James. On the first point, it is, I think, almost exactly 90%. I mean, I think yesterday it was 89%. I think it's 90% today of all adults have actually had the vaccine, the first dose of the vaccine. Every adult has been offered an appointment by now. So the gap between 90% and 100% is uptake. It's people not coming forward for appointments. And therefore, it is really important that we continue to chip away at that literally on a day-to-day basis and encourage people to come forward. If you haven't come forward up until now, don't worry that people are going to frown at you if you turn up now. We want you to come forward. If you've been worried about vaccine, if you're a bit hesitant about vaccine, then there's information available that I hope would reassure you. You can turn up to a drop-in clinic and talk to a vaccinator who can perhaps reassure you. Literally, and we'll assess the 9th of August on, the basis of all of the evidence as we get towards that. But the 9th of August milestone aside, every day right now, it remains the case that literally every individual that is vaccinated represents a wee step forward on that road back to normality. And conversely, every time we've got somebody who could be vaccinated who's not, there's a vulnerability there to this virus that potentially holds back our progress. So I can't stress enough how important it is if you're in the eligible groups to come forward and get vaccinated. On the second point, look, I don't know what Boris Johnson said or didn't say in relation to the allegations from Dominic Cummings, so it's probably not appropriate for me to really comment in detail on that, other than to say two things, I suppose. Firstly, nobody, and certainly nobody in a position like mine or Boris Johnson's, should be glib or complacent about human life, whether that's the human life of a child, a young adult, or an older adult. Human life is human life, and as decision makers, I think it has been a heavy responsibility on all of our shoulders is to try to take decisions that we recognise cannot save every person from this virus, but that minimises the impact of it, taking account of the impact of the restrictions that are in place as well, but to minimise the human impact of this. And I think any leader who doesn't take that seriously should be asking themselves, questions about whether they are fit for office. But I don't know what Boris Johnson's comments there were, so I'm not going to go further. I think everybody, you don't need me to say that last autumn Boris Johnson appeared to be reluctant to impose new restrictions. Now, nobody wants to be imposing restrictions, but it's important, I think, that we all take the decisions that require to be taken. But I've been a critic of Dominic Cummings in the past, and therefore when he's said certain things, so I'm not going to suddenly now decide that he's speaks gospel on everything. I would be a bit sceptical about some of what he is saying, and probably should leave it there as a result of that. Aileen Clark from BBC.
Thanks, First Minister. With the JCVI advice at the moment, which is not to vaccinate all teenagers, does that make it more likely, do you think, that school children will still have to isolate if they're a contact of somebody with COVID next term? And also, could you clarify the rules on social distancing on cross-border trains, planes and buses, and if there's any discussions going on about that with the UK government and other administrations?
On the first point, Aileen, I think it's important we don't get ahead of ourselves. Now, I'm acutely conscious our schools start to return or do return in round about a month's time. I've said before, and we'll be having further discussions about this literally in the days to come, that we will set out fully, well in advance of school return, what our expectations are around not just self-isolation, that is a big decision that we need to take, but the overall package of mitigations that we would expect to remain in place in our schools. Now, clearly vaccination, whether or not all young people are being vaccinated, it has a bearing in that overall decision, but it's not the only factor, but it will be one of the things that we are weighing into the mix. And without preempting those decisions, again, we are acutely aware of the disruption to education of children been asked, sometimes on more than one occasion, to self-isolate. So there's a whole range of complex, interrelated decisions that we have to take here. I am not prepared, any more than I'm prepared to write off the lives of people in the older age groups. I'm not prepared to be complacent about the health and well-being of younger people. But that health and well-being, of course, means weighing the risks from COVID against disruption to their education and the wider impact of some of these restrictions. So we will set that out fully in the days to come, and well in advance of schools returning. Nicola might want to say a word more about that shortly. On the issue of physical distancing rules on transport, because I've seen some commentary around whether trains and public transport are included. I'm very clear on the legal intention of the regulations. It is a statutory requirement that those carrying on a business or providing a service take measures to ensure, as far as reasonably practicable, that a 1 metre distance is maintained. Now, I've seen some commentary to the effect that premises, the use of the term premises might not include a train, for example, and I've just asked our lawyers to look at that to see whether there is any clarification or tightening of that is required. But the intention is clear, and I would expect companies operating in Scotland to follow the law in Scotland, and indeed to follow the guidance that is in place in Scotland, even if it is not contained in statute, because that is, in my view, what the public would expect. So after a bit of prevarication or controversy yesterday, I'm pleased and would thank LNER for making clear that they intend to do that, and I would certainly encourage all cross-border services, when you're operating in Scotland, it is the law and the guidance that applies in Scotland that you should be following, just as the same is true in England, Wales and Northern Ireland. And I think the public in all four nations would expect that to be the case. Nicola, do you want to add anything on children?
Just to say that we're very fortunate in Scotland to have a really excellent expert advisory group on children and young people, particularly in the education setting, which has our best scientific and clinical advisors on that. And they are at this very point in time, assessing really carefully the most up-to-date scientific and clinical evidence in relation to children and transmission in the school setting in particular. And as the First Minister has said, they will advise us in due course. And vaccination, as the First Minister says, is only one part of that. This is all about, again, a risk and benefits balance. But that group certainly, I can assure the public, has the welfare of children at its absolute heart, and the continuation of education as their absolute core reason for being. They want to minimise the disruption that has to take place in education for children as much as possible. And it may be that there are some changes in guidance that will come now that our situation is very different in terms of the pandemic with where we are at this moment in time. So more to come on that, but it's very high up on the agenda at the moment, and advice, I suspect, is fairly imminent.
Thank you. Phil McDonald from Global.
Thanks, Minister. Just returning to vaccine passports, how seriously are you considering bringing these in, and what sort of settings might we see them in?
Phil, I'm not going to go into more detail, because inevitably that will be taken as we are about to announce it for X setting, and we're not at that stage yet. I've said before, I think these issues need to be really carefully considered. You already see it in the debate sparked by the Prime Minister's comments yesterday. There are people who think we should use vaccine passports to open up access as much as possible, and there are other people who think there are serious equity, civil liberties, ethical issues associated with these. So I understand the desire for speed on these things, but we've got to make sure we get this right. These may be things that, if they are introduced, might be in place for quite some time. So we've got to get the decisions right, and when we are in a position to say more, we will say that, and I'm not going to go further on a speculative basis today. Brian Rutherford from Bauer.
Thank you, First Minister. Nearly half of men under 30 across Scotland's biggest cities have not turned up for even their first dose of coronavirus vaccine, and the uptake in Dundee is the worst at 55%. More than 4 in 10 young men across Aberdeen, Glasgow, Edinburgh remain unvaccinated. I wonder, is this the way that the virus continues to spread? And what are you doing about that? And can I just ask as well about the makeup of people in hospital with COVID? How many of those people are fully vaccinated? How many of them are partially vaccinated? And how many of them are not vaccinated at all?
On that latter question, Public Health Scotland have been publishing some detail. Nicola might have more up-to-date detail on that right now that she can share, but Public Health Scotland have been sharing some information, I think, on a weekly basis of the vaccination status of people in hospital. The only thing I would say there is that the vaccines are very effective, which is why we want to encourage people to get vaccinated. But the vaccines, in fact, no vaccines are 100% effective. So the fact that you will have some people who, even although they're double jagged and therefore fully vaccinated, who will still get this virus, and perhaps some people who still become very ill from this virus, doesn't mean the virus is not the vaccine is not effective. Vaccines are really effective, and we should not see the fact that some people, a small proportion of people who are vaccinated still get ill from this, as in any way undermining the need to get people vaccinated. For the vast majority of people, vaccines will reduce significantly your risk of getting very seriously ill from COVID. On your first point, look, we will continue to do everything we can to encourage anybody who is not vaccinated to get vaccinated. And, that includes what we have been doing in recent weeks over not just drop-in vaccine centres in all mainland health board areas, but, in Glasgow and Edinburgh, for example, mobile vaccine clinics that are actually taking the vaccine to people as opposed to expecting the people to come to the vaccine. We are exploring all possible methods of making vaccine as accessible as possible for people who haven't had it yet, but also ways in which we can address any of the other reasons why some people might be reluctant to come forward. Ultimately, vaccine is not compulsory, and we're talking about ethical issues around vaccine passports. There's no serious suggestion you can make vaccine for the population compulsory. So that means that people do have the right to decide not to get vaccinated. But I would really urge people not to exercise that right, but to exercise their right to protect themselves and others as much as possible from COVID. So I would urge people who haven't been vaccinated yet to seriously think about getting the jab as soon as possible. If you don't want to do that on the basis of your own protection, then do it for the sake of people that you are coming into contact with. Do it for their protection, because it really, really matters. And we'll continue to work as hard as we can to chip away at these non-attendance figures to get uptake even higher than the quite extraordinary levels of uptake that we already see. And it stands to reason that the more people in the population that are not vaccinated, the more opportunity this virus has to transmit and to do real harm. And therefore, any sizable proportion of the population that is not vaccinated presents a vulnerability for all of us. So it's another reason why we really need to get people to come forward for vaccination. So if you haven't done it yet, please do it, and don't be put off by anything that might have been putting you off up till now. Nicola.
Thank you. So just to come back to the first question about vaccination and hospital admissions. So Public Health Scotland do publish this now on a weekly basis. The last time this was published was on the 14th of July, and that was data up until the 9th of July. So just to let you know that data is always slightly lagging behind. But at that stage, 2/3 of positive cases of COVID were in unvaccinated individuals. And in terms of COVID positive admissions, 51.6% were in unvaccinated individuals, of which 70% were under 40. So what we are certainly seeing is that the risk, as we would expect from the vaccine efficacy, is much, much higher in those who are unvaccinated and much, much higher in those now, because they are probably less vaccinated than older people, in those who are younger. And we have to remember that the vaccines are more than 90% effective against hospital admission. after 2 doses, and that's all of the vaccines that we use in the UK. So these are incredibly effective. So yes, I think in answer to your question, we are seeing what we would have predicted coming out through the data. The Public Health Scotland report goes into much more detail about 1 dose versus 2 doses. There are no surprises there. It's what you would expect. 1 dose provides a degree of protection, 2 doses provides much more protection, which is what we've always said. I think in terms of those younger people, and particularly those younger males who haven't come forward for vaccination yet, I think, from a clinical point of view, we know that generally speaking, in population vaccination plans, younger people's uptake tends to be lower. We don't accept that. We don't think that that's something that we shouldn't be endeavouring to improve, but it is something that's been noted across a number of different vaccination programmes. And why that is, young people can probably tell you much better than I could. We often think that we are invincible when we're younger. We think that our risk of becoming seriously ill is much less. And with COVID, that's true, but it is not zero. It is very far from zero. And young people do become seriously ill from COVID, as we are seeing now. In terms of what I would say to those people who haven't come forward, I would say, please, tell us what it is that you're worried about, number 1. And number 2, if you're not sure, come to a drop-in vaccination clinic and speak to an immuniser. Tell them what your concerns are. Let them at least discuss things with you and go through the pros and cons for you personally and make an informed choice. It is a choice in Scotland. We're very clear about that. We just want people to make the right choice for themselves. So please just come forward and speak to us. And if there's anything that we're not doing in the line of mobile vans or getting things to places where people need them to be, then please come forward and tell us. More than, almost 4 million people in Scotland have now had a first vaccination. So I think things like adverse events, people are hopefully a lot more comfortable that these are really, really rare. And we can see so clearly the difference the vaccination programme is making in terms of hospitalisations and deaths. So please, every single person, think hard about it, come forward for information. And as many of you as possible, please just join us in protecting yourselves and everyone else.
Can I just ask a follow-up question, First Minister? By what date are you going to make a decision on vaccine passports? And what do you make of these comments from Stephen Montgomery from Scottish Hospitality Group? He's said that this needs addressed now, not in a week or 2.
Well, I'm sorry, I've not seen the comments, but I'm really sorry, but we have to take decisions on the basis of proper consideration. These are serious issues we're dealing with, and for that reason I'm not putting a date on it. We need to consider all of this in the proper way. Neil Pooran from PA.
Thanks, First Minister. On the Protect Scotland app, there's been reports that it's not pinging people, identifying them as close contacts at nearly the same rate as the equivalent app in England. And well, of course, there might be different rates of the virus in Scotland and England, but do both apps have the same sensitivity? And are you confident it's working as well as it can right now? And also, what are you doing to encourage people to keep the app active on their phone, to keep using it and not delete it?
Thanks, Neil. As far as I am aware, and I'm not a technical expert on how apps work, I'll maybe get somebody with a technical knowledge of this to give you a more developed answer. But as far as I'm aware, there is the same degree of sensitivity, and therefore there would be no reason why it was pinging less people than in England. Of course, after a period where the opposite was true, just to be clear about that, we are now in a position where case rates are lower than in England. So that means there will be fewer, if there are fewer people testing positive for COVID, it follows that there are fewer people being asked to self-isolate. So there may be a feature there. But unless there's something I am not technically aware of, I'm not aware of any particular issue there. And I am confident that it is working as well as it could and should be. What I'd say to people is, test and protect is a really important part of our defence. It should never be our first line of defence. That is all of us behaving in ways to limit transmission. But test and protect is there as an important part of our defence, and the app is a part of test and protect. So it's not the totality, but it helps quickly and easily let you know if you've been a close contact of somebody with the virus, and it does that confidentially. So it's a really, really important thing that everybody should have on their phone and keep on their phone. I know there's lots of angst just now, and I understand it, because this is hugely disruptive to people's lives about, pingdemics, and, it is not the app that's causing the problem. It's the virus that's causing the problem. And the more we get case rates down, the more we'll get the numbers being asked to self-isolate down. But while we have levels of the virus as they are just now, self-isolation is a really important thing for everybody to be doing to try to limit transmission. So I would ask people to continue to stick with this, just as we're asking people to stick with things more generally.
In on the app there, and just to say there are a couple of subtle differences between our app and the NHS X one. We do use a different type of calculation for proximity contacts. Now that is not to say that ours is less sensitive, it's just that theirs is done on a complex algorithm, whereas ours takes a particular distance and time, and it's more simple in that way. I don't think that in any way decreases the sensitivity of it. But the other really crucial thing about our app is that it requires people who are positive and who get a positive result to put a code into the app that then allows their contacts to be pinged. And clearly the other thing about our app is that it's anonymous. It's completely what we call decentralized, which means that it relies on, as I say, that person with the positive test putting it in. There's no way of us knowing otherwise whether that's happened. So I would just encourage people, because we have heard of people being reluctant to put the code in and to ping their contacts. Please, please, please don't hesitate to do that. The app is there for a good reason. It is there to let people know that they might have been at risk. And now, of course, anyone who is identified as contact, we are recommending that they get tested. So there's a very good reason to alert your contacts through the app. No one will know that it's you. It's all completely anonymous, and you're actually doing them a huge service by allowing them to get themselves tested and allowing them to continue to go on to protect other people if they have been at risk. So there are differences, and we just want to encourage everyone to continue to use it as best they can, because it's one of the tools in our armoury, and it's potentially one of the tools that is very easy for us to keep going and keep using. So please, please, everyone, just keep putting your test results in and keep helping us to stop the spread.
Okay, thanks.
Just follow up with Dr. Steedman there quickly. Do we know the rate at which people are not putting those details into the Protect Scotland app?
No, because our app is anonymous and decentralised specifically for that reason. And we're not policing people in this way. We're asking people and expecting people to do this in an effort to protect their contacts and warn their contacts. So no, we don't have that data specifically because our app is anonymous, which means that people can use it with absolute impunity, knowing that data doesn't go anywhere else.
Okay. The anonymity is an important part of the confidence
in
the system. Right, I've still got quite a large number of questions, so I'm going to try to speed up a little bit now so that we can make sure we will get through them all, but get through them all in a reasonable time. Conor Matchett from the Scotsman.
Thank you, First Minister. Apologies, this is a bit of a long one. Just to start with a question for Dr. Steedman, if I were to say to you that two people, both wearing a mask, but one of whom is infected with COVID-19, and they're both physically distancing by a metre, if that situation reduces the risk of COVID-19 transmission to 1.5%, and if they extended that physical distancing up to 2 metres makes COVID-19 transmission impossible, is that a scientifically accurate understanding of how effective a mitigation against COVID-19 masks are? For the First Minister, as you'll know, the Deputy First Minister shared a graphic yesterday claiming exactly that. He said he didn't know its source, and he's still not taking it down. Is it acceptable for the Deputy First Minister to share public health information to his 100,000 Twitter followers without first checking that it's accurate? And if it is correct, how can you defend the 2 metre distancing policy in place during previous lockdowns? And finally, apologies, I know it's a long one, can I also ask whether the removal of COVID-19 restrictions will include a legal obligation on individuals to self-isolate if they are identified as a contact, i.e. post-August 19th, will people still be legally obliged to self-isolate? Thank you.
Well, on the last part, I'll tell you that when we set out what we're doing on August the 9th, I've said repeatedly I'm not going to preempt decisions. We'll take these decisions in the considered I hope in the main, sensible way we take them. I'm going to cut to the chase from that rather long and laborious question you asked there. The Deputy First Minister tweeted an image yesterday that was intended to illustrate what is absolutely the case, that wearing face masks protects people from transmission of the virus. So if I wear a face mask, it gives you some protection. If you wear a face mask, it gives me some protection. He was illustrating that point, and I think the more we can illustrate that point, the better. What I'll say in addition to that is I think we recognise that in seeking to illustrate that, we should take care to use properly verified graphics, and we'll certainly take that on board in terms of how we tweet that information in future. But getting the general point across, he is absolutely right to seek to do, as I seek to do that on a general ongoing basis as well.
Just to say that it's incredibly complex, and in the interest of time, I won't take you through everything, but it all depends on the type of mask. Of course, some of the information which I believe went into that particular infographic was a mixture of information from real world infection studies, but also experimental studies of puffing bits of virus in the air and seeing whether certain masks stopped it. Face coverings are different from surgical face masks. So it's incredibly complex. And I think that figure was an effort to simplistically represent the fact that masks and face coverings do provide some protection. The degree of protection is variable depending on the mask and on the distance from the person. Because it's so complex, there's a lot of very simple infographics out there that try very hard to get that message across. So I understand that. But actually, what's underneath it is very complex. But the bottom line is face coverings and face masks provide protection both to the wearer and to the people they come in contact with, the degree of which is variable for a number of different reasons, but they do protect.
Christine Lavelle from the Sun.
Thank you, First Minister. Airport bosses have raised concerns about Scotland's lack of a digital vaccine passport for international travel as the rules for those arriving from ABRA-list countries eased this week. They've warned that the current letter system having to be manually checked will lead to queues and more interactions amongst passengers. So it was just to ask, where are we with the development of a digital system, and when are we likely to see it being rolled out?
It's under development right now. I don't have a date, but we will see a digital solution come into operation over the coming weeks. But the paper service is available, and I would, trust airports to make sure that all of their arrangements for the travelling public, people who are travelling, are taking account of the proper mitigations to stop the virus spreading. And it gives me the opportunity to say that while we do have the red, amber, green categorisation, our advice to people remains right now: you should not travel overseas unless it is essential. Now, for many people, essential travel will include, of course, seeing loved ones that live overseas, and I recognise that. But right now, the advice is not to go for non-essential travel overseas because of the risks of new variants that we know we face. Georgina Hayes from the Daily Telegraph.
Thank you, First Minister. Given that it's now less than 3 weeks from August 9th when most legal restrictions are set to end, can you confirm, just so that businesses can prepare, whether nightclubs will be able to reopen without the requirement for guests to wear face masks? Thank you.
No, because I won't confirm decisions for the 9th of August until a week before the 9th of August. That's how we've always done it, and it would be utterly irresponsible to do it in any other way, because it means I wouldn't be taking account of all of the up-to-date data in answering that question. Mark McLaughlin from The Times.
Minister. On Saturday, Humza Yousaf said he would speak to the Northern Ireland Health Minister about his decision to cut the gap between jabs to 6 weeks. He said he questioned the logic of the Northern Ireland Executive's claim that this was done within JCVI guidance. Have you or the Health Secretary or anyone in the government spoken to him yet? And is the Ulster Unionist Party's logic of adapting vaccine guidance to local circumstances something that the SNP can get behind? And more generally, why do your public health experts defer to an English vaccine regulator on the gap between doses and vaccinating children over the World Health Organization and the European Medicines Agency, which regulates vaccines in a union that you actually want to be part of?
If I framed the answer to that question in the way you framed the question, I would probably be traduced all over the front page of your newspaper tomorrow, and possibly rightly so. I don't know, so I'm going to resist the temptation to do that, frankly. I don't know whether Hamza has had a conversation with the Northern Irish Health Minister since Saturday. I'll happily follow that up. I discuss these things regularly, as recently as yesterday afternoon with the Chief Medical Officer. We follow the advice of the JCVI on matters to do with vaccination and immunisation. That's not something that has just been created under an SNP administration. It's been the case since the dawn of devolution back in 1999. All 4 nations do that. It is the body that gives vaccination advice to all 4 nations, which is why I think your characterisation in the question is, to put it mildly, a little bit pejorative. So we will do that. That is not to say that at times I don't, as a non-clinician, and I think you can hear some of my impatience maybe around the issues about vaccinating younger people come through. But I'm not a clinician. And if I was to frame my answer in the way you framed your question, would I get traduced all over the front page of your newspaper? If I was to stand here and say, I don't care what the experts say on vaccinating children, I'm going to decide that we're doing something different, I'm pretty sure there would be pretty choice headlines, not just in your newspaper tomorrow, but in all newspapers. These are really difficult, sensitive, complex decisions. And the most important thing, in my view, about a vaccination programme, and we reflect on this when we're talking about trying to get uptake levels as high as possible, the most important thing is public confidence, and that is particularly true when we're talking about the health of children. So whatever my non-clinical opinion might be, I will continue to follow the advice of the experts that we rely on to advise us, but be open about asking those experts to make sure that they are considering all of the data and keeping these things under review on an ongoing basis. Michael Blackley from the Daily Mail.
Thank you, First Minister. You've always made clear, and indeed have reiterated today, that steps out of lockdown are very much linked to vaccine take-up. We've found out, we know from the public figures that there's nearly 500,000 people who still haven't received the first dose, and the figures that you've given today is that only an additional 2,483 got the first dose yesterday. I just wondered if you could maybe be clear, I think on my workings, if that continues for each of the days up to August 9th, we would only be talking less than 50,000 more of these 500,000 people getting the first dose. Is that rate of progress a threat to lifting all restrictions on August 9th?
How about we focus on encouraging people to get vaccinated as opposed to kind of assume the worst and then try to create doom-laden sort of consequences from that? I'm not going to do anything other than stand here and be frank with people. Vaccination is our best tool against this virus right now. Therefore, the more of us that get vaccinated, the more effective that tool will be. And the converse of that is true. There's no mystery around that. But I'm not going to stand here and say, oh, well, if only 4 people get vaccinated a day, we're in terrible position. People are not stupid. They can understand the implications of that. I'm going to put all of my efforts into persuading those who have not taken up the opportunity of vaccination to get vaccinated, because that is the best route for all of us out of the situation we're in right now. Okay.
I think every single person counts when it comes to vaccination, both from the population point of view and from the individual protection point of view. So if I think there's still, a few thousand every day that are coming forward for first doses, then I think that's fantastic. And long may that continue. And every single person that comes forward to get their first dose, I absolutely salute them and thank them for doing that for themselves and the rest of us. I mean, we can't forget the enormous success that this vaccination programme has been. And I mean, I want to thank all of the staff involved in setting that up, tirelessly delivering these vaccines. We're in a situation where 90% of our over 40s have had 2 doses of vaccine. And if we thought about that before Christmas, we would have given anything to be in that position. It doesn't mean that we rest on that and say that's enough. Of course, we want more. I'll always want more to come forward until we have 100%. But that maybe isn't realistic. But the vaccination programme has done an absolutely amazing job, and they're to be commended for it. And please, just every single person that comes forward from now on, we are grateful. It's not just about the overall number, it's about each individual ensuring that they're protected.
Vivian Aitken from The Record.
Good afternoon, First Minister. If I could just take you back to vaccination passports briefly. I know you said you won't come up with a date for when you're going to make your decision, but can we assume that a decision will be taken before nightclubs reopen, whenever that may be, whether it's this month, next month, Christmas, you'll make the decision on vaccination passports before that? And can I also ask, realistically, and I know this is perhaps a difficult question, but realistically, when can we expect to see the NHS return to more normal levels of waiting times? We see again this morning that A&E figures showing only just above 80% of people are being seen in time. And I spoke to a lady this morning who was told yesterday that she might have to wait 6 months for a CT scan to get a new heart valve. People are still suffering unrelated to COVID. So when can realistically we see it getting back to more normal?
On the first question, I think it's a reasonable assumption that we will say more about the state of our decision making around vaccine passports before we signal the reopening of places like nightclubs, but don't read into that anything about what that decision might be. And the second point, the NHS is in a process of recovering from the COVID impact, and that means getting non-COVID treatment back to normal, catching up in the backlog and bringing waiting times back to where we want them to be. Remember, pre-COVID we had a waiting times improvement plan in place that was starting to bring waiting times back to better levels, but obviously that has been materially impacted by COVID. That will take time. I'm not going to stand here and again put a date on that we will set out a more detailed NHS recovery plan shortly, which will give more milestones around that. The only other thing I would say, and it's a really fundamental point, is that there is a very direct relationship between levels of COVID and therefore numbers of people requiring NHS care for COVID and the ability of the NHS to get back to normal on non-COVID care. The more COVID patients that the NHS is requiring to treat, the more difficult it is to get back to normal. To put it undoubtedly oversimplistically, but just to illustrate it, every bed in one of our hospitals that's occupied by a COVID patient is a bed that is not available for non-COVID care, which is why, even although hospital cases are much lower than in previous waves of the virus, our room for manoeuvre is also narrower and smaller because we are trying to prioritise as much as possible the recovery of non-COVID care. So it's an ongoing process, and it will go faster the more we keep COVID under control, and inevitably it will be held back if COVID gets out of control again. So that relationship is really important.
Just to add to that, so the NHS recovery plan is part of the manifesto commitment for 100 days and so is being worked on as we speak and will be again published shortly. Although that sets out what we anticipate and expect for the NHS in the slightly longer term out to 2026, it also will set out the delivery within the first year, and I suspect that some of that will be in relation to these sorts of waiting times that you're talking about. But just to say that part of that is not just about doing the same thing and not just about starting things up again, but it's about doing things differently. So we're very keen on innovation. We're very keen on doing things better if we possibly can and learning from our experience with COVID. And an example of that is in the National Elective Treatment Centres, which are being set up, which will also have elements of diagnostics associated with that, and the Centre for Sustainable Delivery in the Golden Jubilee National Hospital. So there's a great deal of work going on in that area. And just finally, the other thing that we need to do, of course, which I just always want to emphasise so that people don't forget, is that we need to support our NHS staff who have gone through an enormous amount over the last more than a year. and who need to be supported in terms of their welfare as we seek to redesign and recover our NHS. We haven't forgotten about you.
Thank you. Tom Martin from the Express.
Hi, good afternoon. Thank you, First Minister. If I could just return to this issue of uptake amongst the younger age groups. In an earlier answer, you referred to continuing to explore other avenues to chip away. What things are you actually looking at? What other concrete measures can you take to sort of encourage these people to come forward and take their jabs? For example, is any more sort of thought being given to the use of vaccine ambassadors?
I don't have particular examples to share with you today. It was a general statement that we explore every single opportunity. We have used voices to encourage vaccine uptake, but I suspect it is more in the groups that haven't come forward so far. It will be, and I'm oversimplifying here, it will be a mixture of accessibility that we need to further improve, and we're already doing a lot around that, but also addressing the fears that some people will have about vaccine and whether the risks of COVID to them, because they're younger, are sufficiently serious to justify getting vaccines. So we will continue to explore every way of addressing both of those issues. Seth Carell from The Guardian.
Thanks, First Minister. My question's been asked, so I can move on to the next person.
Okay, thanks, Seth. Much appreciated. Helen McCardle from The Herald.
Good afternoon, First Minister. You said in your statement that cases are very much on a downward path, but you'll know that some of the data we've been seeing recently from the ONS surveillance and also from wastewater sampling isn't exactly reflecting that it's still seeing an increase or seeing an increase continue at the point where confirmed cases look to have peaked. So I wonder what advice you're getting on that from your advisors on what might the reasons be for that. For example, is it people being reluctant to get tested because it's summer, it's holiday season, things are opening up, and maybe they just don't want to have to get caught out and have to self-isolate whether they have symptoms or not? Thank you.
Nicola will want to say something about this. It's a really good question, and while reported daily cases are on a downward path, I think I said this in my parliamentary statement last week, that only reflects people who are coming forward and being tested, and we've known right from the start that there will be a proportion of people who have COVID who don't get tested. So we have to pay attention to some of the wider surveillance intelligence that we get. You mentioned wastewater sampling, which is one of the things we look at. The ONS survey has been important to us for some time now. And it's because of the inherent uncertainties in all of this that I'm still being advised to be cautious, and there is still a lot of caution in the decisions that we are taking. What we do know is that, when reported daily cases, the ONS survey, we're not comparing always like with like, so there are lag effects in some of this data. So, I know from past phases of the pandemic, it has taken longer for some of that surveillance information to mirror the trend of what we're seeing in reported cases. So lag effect is part of that. One of the things that I look at, and again, I don't want to suggest this is exhaustive or exclusive or all important, but one of the things I look at on a daily basis to sort of give me a little bit of assurance that the reported cases are not representative of a mass under-reporting of the situation is hospital and ICU figures. If we were in a position where the true level of COVID right now was massively higher and rising, where reported cases show that it is falling, then I think we may expect to see a continuing much sharper rise in hospital admissions than we're seeing just now. That is not to say that they are where we want them to be. So there's all sorts of different bits of information that we look at to try to gain as holistic a picture as possible. But there are uncertainties in it, and that is why, as long as there are those uncertainties, caution remains, I think, the most important watchword of all.
So I think you've made the most important point there, which is about the other data that we have, which supports that that case numbers are actually really coming down, and that's to do with the hospital data. We have a full package of surveillance measures, and this is exactly why. Some come up early, some come up later. Some can tell you, like wastewater sampling, about particular hotspots, for example, because wastewater clearly drains from a certain area, it may be that the level of infection in particular areas is higher than it is in others. Whereas, of course, clearly we, when we're looking at case numbers overall, are looking at the whole population. The other thing is, of course, that it's possible that with wastewater sampling, because it's taking a number of different samples from different places and different people, it's possible that those people in a particular area might have higher viral loads for some reason than other people. So it's incredibly complex, but you're absolutely right. We have noticed the wastewater is still on its way up in some areas, and we're watching that extremely carefully and triangulating it with the other data. I think the other thing to say is that it's always possible that there are genuinely asymptomatic cases of COVID out there, and therefore people not seeking a test because they're thinking to themselves, well, I just don't have any symptoms, why would I? And that's exactly why we have the offer of the lateral flow tests for everybody in Scotland. And I would please encourage people to pick up a pack from community pharmacy or order it online. Please test yourself with those twice a week, because there probably are asymptomatic cases out there potentially going on to transmit who just don't even know about it and don't even think about taking a test. So a stark reminder that it's possible to have it and not have any symptoms, but we still want to know about it. So please do the lateral flow tests.
Thank you. And lastly, Paul Mallock from DC Thomson.
Good afternoon, First Minister. Just to take you back to Connor's question that you asked earlier, even if the posts shared are very well intentioned, which I don't think anyone is disputing, they were from several MPs and MSPs yesterday regarding face mask coverings. Doesn't it undermine the work that Public Health Scotland and doctors and scientists have been doing over the last 18 months to try and lead our recovery through the science? And doesn't it also give those who would use fake news to disrupt public trust further ammunition?
No, I don't think it does, but I do recognise the importance of people like me and the Deputy First Minister and ministers sharing verified information. The point we're trying to illustrate, and that John was trying to illustrate yesterday, is a really important point to illustrate, and it is the case that face coverings help protect us, and therefore I don't think we should lose sight of that point. But I take the point about the credibility of the graphics that are helping to illustrate that, and I'm sure we will all reflect on that. Can I thank all of the journalists for questions today, Rachel for our interpretation, and Dr. Steedman for so expertly helping me with the questions today, and thank all of you for joining us. We'll keep you updated obviously in the days to come. I think in summary we are we think, as you've just heard us reflect on in relation to the penultimate question there, we think we're in an improving position, although we're not complacent about that. But the only way to keep the position an improving one is for all of us to continue to do the things that we know helps to interrupt and prevent transmission. So stick to the rules that are still in place: physical distancing, face coverings, hygiene, ventilation. All of these things are incredibly important, and most important of all is to come forward for vaccination. So if you haven't had your first dose yet, please come and get your first dose. And if you have had your first dose, then as soon as you hit 8 weeks, go to a drop-in centre and get your second dose so that you have the full protection of the vaccine. So thank you all very much, and I will see you soon.